What's going on, guys? Escape your cubicle here. We are live. We're waiting to see. Let's see. We're waiting for a live press conference to come on to tell us. There's no sound right now, though, so I don't know what we're going to get here. We're waiting to see if we're going to get any additional restrictions coming in for coronavirus out here in Las Vegas. And I have the press conference on right now. I was going to play the audio for it, but right now it just says COVID-19 Nevada update. It's supposed to start at 4:30 Pacific time. We're right about there now. It's 4:31. And wait for these guys to get their audio turned on. I think they're working on their press conference. So I'm just going to relay. Here we go. Let me know if you guys can hear this.
So again, we'll turn it over to the governor in just a second.
So they're waiting on Governor Sisolak right now to announce whether or not they're going to have additional restrictions. I think they will, because we're seeing more restrictions in California. California just announced they're closing all restaurants with the exception of takeout or delivery. You can't dine in at any LA, not all of California, but Los Angeles County. You can't dine inside the restaurant. You can't even sit out in front. So that's what's going on in California, and they got overnight curfews there as well, I believe. So here in Las Vegas and Nevada, we're just waiting to see what the governor's going to announce momentarily. So just thought I'd go live, let you guys
We're now live, and I'll turn
see
this over to Governor Sisolak.
See what he says. Hopefully you guys can hear it.
And thank you all for joining me in this virtual format today for this press conference. I am not wearing a mask. I am still in isolation and residence in Carson City. So that is the reason I'm not wearing a mask. As many of you know, I tested positive for COVID-19. I'm feeling good, and I'm currently not experiencing any symptoms. I cannot express enough my sincere gratitude to all of the health professionals who assisted me through this process. As a state, we owe them a debt of gratitude for their continued service throughout this entire pandemic. Although I'm not experiencing symptoms, many Nevadans who become infected with COVID do. My heart goes out to all those who are sick with this virus currently, and especially to the families of the more than 2,000 Nevadans who have died from COVID-19.
Can you guys hear this? Let me know if you can hear it in the comments.
These families and their grief. They are constantly in my prayers. As all of you are aware of the escalating COVID-19 cases in our nation and in our state, almost 2 weeks ago, I asked that we step up our efforts to mitigate the spread of this dangerous and highly contagious virus. I've been in constant contact with our health professionals, economic experts, our vaccination preparation team, and many others to assist our current surge and possible next steps. As of today, 13 of our 17 counties are flagged for elevated risk of transmission. In the beginning of October, only 2 counties were flagged. Our state positivity rate is at a record 16.5%, and as I mentioned, we have surpassed 2,000 deaths. Just recently, we experienced a record number of daily cases, 2,416 in just one day. Our previous record was 1,639 in July. Today, we once again had over 2,000 cases reported, 817 in Washoe County alone, greatly exceeding their previous record. Our case rate growth is at a wildfire level, even outpacing neighboring states such as Arizona. All available models indicate that Nevada is in a red zone, and our health experts anticipated continued case growth based on current trends. In fact, 10% of all COVID cases recorded in Nevada since the beginning of this pandemic were reported in the last 7 days. That's 10% of our total cases have been recorded in just the last 7 days. Every minute, a Nevadan is diagnosed with COVID-19. Our hospitals are experiencing record numbers. And as you heard from Dr. Tony Sloan of Renown a couple of weeks ago, they've started treating patients in an alternative care site in the parking lot. Some of our hospitals are experiencing staffing shortages. because they have become infected or their family members have been diagnosed with COVID and workers are in quarantine. Due to massive increase in community spread, we are experiencing significant outbreaks in our institutional settings, including our correction facilities. Our public health infrastructure, from our hospitals to our state health response, is quickly becoming overwhelmed. And from the start, I've made clear that in addition to saving lives, one of the main goals of our response is to protect our public health system and our hospitals from being overwhelmed. Let me explain this quickly. Whether you believe in the science of COVID or not, the reality is this. It's simple. COVID is filling up our hospital beds, and that threatens all Nevadans. If hospital beds continue filling at this rate and staffing shortages continue to increase as they are now, that means all Nevadans will have limited access to the care they may need. It's not just for COVID. If you get in a car accident or have a heart attack or break a wrist, you won't be able to access care if our hospitals are full and there isn't enough staff. This is our biggest threat. You saw it in New York. You can see it now in El Paso. This cannot become our reality. There is a consensus on one inescapable conclusion. We are in a rapid trajectory that threatens to overwhelm our healthcare system, our frontline health workers, and your access to care. So it's time to act. From the start of the pandemic, there aren't any decisions that don't have negative consequences. Weighing the loss of jobs and businesses versus the loss of health and lives is painful, without a perfect solution. While prioritizing the health and safety of Nevadans, I am also balancing the significant ramifications that further restrictions will have on our suffering economy. No state struggles with this more than Nevada, due to the lack of diversity in our economy. I've mentioned this High Wire Act before, this Great Balancing Act, and it feels like we've been living in this no-win situation for nearly 9 months now. And believe me, I understand the stress, emotionally, mentally, economically, that you are all going through. Today, I'm announcing new restrictions in an effort to get this wildfire under control. I am not issuing a shutdown order. Repeat that, I am not issuing a shutdown order. My goal is to aggressively try to attack this spread while maintaining some portion of our economy and our daily lives. That's why I'm announcing that effective Tuesday at 12:01 a.m., Nevada will be operating under a statewide pause with the following conditions in place. We will keep these restrictions in place for at least the next 3 weeks. At least the next 3 weeks. I'll talk more about the next steps soon. First, I'm strengthening Nevada's mask mandate across the board. Nevadans and visitors are now required to wear a mask at all times when you're around someone who is not part of your immediate household, whether indoors or outdoors. This expansion includes requiring masks during private gatherings. I will talk more about private gatherings in a minute. In the last month or so, new research has emerged that continues to validate the importance of wearing a mask. They continue to be an essential tool in our fight. Going forward, we will reduce capacity in certain high-risk areas that have been shown nationally and in Nevada to contribute to the spread of COVID-19. Under the statewide pause, no additional businesses will be closed, but capacity limits and new mitigation measures will be imposed on both businesses and gatherings. I will start by explaining what's changing. Restaurants and bars, they are currently operating at 50% capacity. Under the statewide pause, they may continue to operate under strict social distancing requirements at 25% occupancy, indoor and outdoor. No more than 4 patrons per table, and seating at bar or countertops must continue to be socially distanced under the existing guidelines. Restaurants and bars should continue to have hand sanitizer available and should be conducting health screenings and/or temperature checks. For restaurants and bars that serve food, reservations are required. No walk-ins will be allowed. I know the majority of our bars and restaurants are doing their best, but these settings are proven to be high risk because they allow the opportunity for people to remove their face coverings in indoor settings around people outside of their households. That's how the virus spreads. That's why I encourage curbside delivery and/or carryout operations, and why our healthcare experts want to remind Nevadans and visitors that you must keep your mask on at all times when you are not actively eating or drinking. Regardless of whether you are 6 feet away from others or not, you must maintain your mask at all times when not actively drinking and eating. If you choose to dine indoors, keep your mask on as much as possible. I encourage restaurants and bars to try to expand outdoor seating options, and I encourage local governments to work with these businesses to meet this goal. Gyms, fitness and dance studios, and places like martial arts studios currently are operating at 50% capacity. Under the pause, they may operate with no more than 25% occupancy under strict social distancing requirements. We are strengthening our mask mandate with no exceptions for indoor exercise. Masks must be worn at all times unless you are actively drinking. If the activity is too strenuous to be done while wearing a mask properly, you must seek an alternative exercise. Other businesses that will be moving from 50% to 25% capacity during the pause include the following: museums, art galleries, libraries, zoos and aquariums, arcades, racetracks, bowling alleys, miniature golf, amusement and theme parks, and other similar activities. Additionally, gaming operations will be restricted to have no more than 25% occupancy and must operate pursuant to requirements issued by the Nevada Gaming Control Board, including health and safety policies. Restaurants and bars within gaming establishments will be restricted to the 25% capacity under the statewide pause. Public gatherings. Recently, we took great steps to increase gathering size to 250 people or 25 or 50%, whichever was less. Unfortunately, due to the surge we're experiencing, we must decrease these limits during the pause. Public gatherings will be limited to no more than 50 individuals or 25% of fire code capacity, whichever is less, under strict social distancing requirements. This includes places of worship, indoor movie theaters, live theater performances, casino showrooms, weddings, funerals, celebrations of life, milestone celebrations, and any other event where members of the public may be gathered together at the same time in the same place for the same purpose. No large gathering plans will be approved during this time. Again, all gatherings must be limited to 50 people or 25%, whichever is less. If larger events have been approved to take place in the next 3-week period, they must be canceled. Private gatherings. In addition to public gatherings, this statewide pause will also include new and necessary limitations on private social gatherings. We know a significant source of spread is right in our homes, and we must do all that we can to prevent it. Under the statewide pause, private gatherings will be restricted to 10 people or fewer from no more than 2 households, whether indoors or outdoors. 10 people or fewer from no more than 2 households. As I said before, face coverings will now be required in both public and private settings whenever you're with people outside of your household, even if you're socially distant. And while I beg all Nevadans to listen to our health experts and the CDC by only spending Thanksgiving with your household members, if you choose to gather with those you do not live with, you must all wear masks. Additionally, there will be a pause on adult and youth sports tournaments during this period, effective Tuesday morning. There will be a pause on all adult and youth sports tournaments. Retail establishments, including malls, will not have to change their capacity during the statewide pause and continue operating at 50%. Retail grocery stores retail and grocery stores with over 50,000 square foot capacity will now be required to have employees at all public entrances counting patrons to assure compliance with capacity limits. Again, I want to strongly encourage and promote online ordering, curbside delivery, and/or carryout options. As a reminder, every business venue and gathering space is required to post capacity limits under COVID-19 directives at all public entrances. You can find downloadable capacity signs on the NV Health Response website. Now, what won't change under the statewide pause? Brothels, adult entertainment establishments, day clubs, and nightclubs will remain closed. Again, retail establishments will not have to change their capacity limit of 50%, but some will have new mitigation requirements in place. Additionally, the following businesses can continue operating under the current standards but will not have to adhere to new restrictions under the statewide pause. Hair salons, barbershops, nail salons, and businesses that provide aesthetic skin services. Spas, massage therapy, and massage establishments, body art or piercing establishments. Finally, community and recreational centers will continue to operate at 50% capacity, understanding that they provide critical childcare services during this time of need. I want to be clear that the new public gathering limits do not apply to our school districts in Nevada. And I want to take a few minutes to talk about schools now. The very first emergency directive I issued after declaring a state of emergency back in March was to temporarily close schools. At that time, none of us could have imagined that we would have some children in our state who had not set foot in a school building for more than 8 months. Since I made the difficult decision to close schools and their buildings, we have seen our infection rates and risk factors increase and decrease in response to actions taken. That includes actions that government has taken in regards to testing, to issuing stay-at-home orders, closures, and the gradual reopening of our economy. But it also includes actions that have taken as individuals in response to whether or not all of us are doing everything we can to keep our neighbors and our families safe. Whether we wear our masks and refrain from taking unnecessary risks. Let's be honest. Our casinos, hotels, restaurants, and bars are open with strict restrictions so that we can protect our economy. Meanwhile, the majority of our school buildings across our state are closed, and our kids are suffering as a result. Our educational system and our economy are not mutually exclusive. They are tied together. As long as school buildings are closed, our economy cannot be fully open. Mom and dad can't go to work if they have children learning from home who need supervision. We must reprioritize keeping our kids in the classroom or getting them there. Throughout this crisis, we have been talking about protecting our vulnerable populations. While children are not as physically vulnerable to COVID-19 as the elderly or medically at risk, that certainly doesn't mean they are immune to its effects. They too are vulnerable in this pandemic, and they desperately need all of our support. As I said, we have students who have not been inside of a school building in over 8 months. And while we're doing everything we can to provide community support for some children, that could mean that they have not had access to reliable food, to safe shelter, or to caring adults who can intervene immediately if something isn't right in over the last 8 months. We've talked about wearing masks to protect our elderly, our parents, and our grandparents. And we've talked about staying home so we can keep our economy open. Today, I'm asking you not only to follow through with these tougher restrictions during the statewide pause for the vulnerable and our economy, but to do it because our children deserve our support. We have seen more deaths by suicide among students this fall than in years prior. And it breaks my heart to share that victims have included students as young as 8 years old. We are in a pandemic, which caused an economic crisis, which has created a mental health crisis. And getting children back into school buildings is a key way that we can ensure that they are getting the education and support that they desperately need and they deserve. That's why we must do everything we can to help prevent the spread. That's part of why I am putting Nevada in a 3-week statewide pause with restrictions I just spoke about. The restrictions I outlined tonight apply statewide. They are baseline standards for all of our communities. But I would be remiss not to remind local governments of their ability to enact stronger measures, especially if your local public health officials are giving you recommendations, or if your hospitals become overwhelmed, or if you experience outbreaks in your counties. Take action. The measures I am announcing tonight, our statewide pause, will be in effect for a 3-week period. Throughout this pause, we will be evaluating our situation and looking for signs of concern or improvement. We will monitor our transmission rate, the slope of the epi curve, and our percentage increase of cases. Depending on the trends, Nevadans can expect a few outcomes. If our percentage increase of cases begins to slow and our epi curve begins to plateau, we will make an evaluation of whether it's a consistent trend or whether we need more time under these restrictions to ensure that the downward trajectory stays in place. Or we may consider slowly loosening back to the restrictions currently in place. The numbers in the virus, as well as our individual and collective actions, determine the timeline. If this action is not taken seriously and our situation worsens in the next 3 weeks, continuing the current trajectory that threatens our healthcare infrastructure, I will be forced to intervene and to take even stronger actions. Stronger actions will be targeted at high-risk settings and may include the prohibition of indoor dining and service at restaurants and bars, closure of gyms and fitness facilities, severe restrictions on gathering sizes. That is what our future holds if our trends do not improve. As your governor, I am confident that I did all I could to avoid further restrictions and keep us on the path forward. But now I must act. I am hopeful that these restrictions announced today, going into effect on Tuesday, will help reduce our caseload. I don't want to impose further restrictions. We are too close to the real solution, the vaccines, to give up now. I remain encouraged by the developments with the Moderna and Pfizer vaccines. There is a light at the end of this tunnel, and we are getting closer, but we do not have a vaccine yet. There is no doubt that this surge is a global and national problem, but it's our problem as Nevadans to fix what we can fix within our own state. So in this moment, with these new restrictions, and with that optimism on vaccine programs in mind, I'm asking all of Nevada's leaders, business, labor, religious, elected, associations, academic, and many others, to intensify your efforts even more, to educate, inform, and model what is required of all of us to bridge the gap to the vaccine, to fully reopen our lives and to propel Nevada forward once again. I implore you to tap into Nevada's independent spirit in this moment and consider your own personal responsibility. We decide our distance to others. We decide how long we spend in a high-risk setting. we decide whether we're going to prioritize getting our kids into the classroom, allowing our business to operate by following responsible measures, and protecting our hospital system. If it doesn't feel safe, it isn't safe. Be determined, offer help, and hope to others. Believe in our future, and know we are closer to the end than to the beginning of this terrible pandemic. Thank you. I appreciate your indulgence, and I will now take some questions. I believe my staff is on the Zoom to facilitate this process.
Thank you, Governor Sisolak, and thank you everyone for joining us. So we do have some hand raised. This is Megan Delaney, Governor Sisolak's comms director. I'll be calling on the folks with the hands raised, and then if you could, I think you can unmute yourselves if you're on a computer using the button. If you're on a phone, you might need to dial *6. We'll go first to Vanessa Murphy. I see your hand raised. Vanessa Murphy, channel 8. If you could try to unmute yourself, and then you can ask the governor your question.
Thank you for taking my question. Governor Sisolak, how do you plan on enforcing, for example, limitations on private gatherings and also this stronger mask mandate you're referring to?
Well, we are certainly not the mask police, but I have done everything I could to help spread this virus. It's now incumbent upon all of us as residents in Nevada to do our part. I hope that people understand the science that we're dealing with, the medical and healthcare realities that we are dealing with, and that they will comply with the directives that are in place.
All right, guys, I'm going to wrap it up here. They're just going into questions now afterwards. I'll give you a quick rundown of what I heard anyway. They said, no, the numbers are not great. They're not getting better. They're probably getting worse. There's no what he would call a lockdown coming to Vegas. So that's good news. That's the good news that I see from it. I was worried about maybe closing down casinos for a couple of weeks or something like that. So that's good. They're not closing down. Pretty much they're not closing down anything as far as what I heard, unless I got something wrong. So I'll just go over real quick. They're going to limit restaurants and bars to a 25% capacity. Previously, I think we were at 50% capacity. For restaurants that you're going to dine in at, you've got to have a reservation to get in there and eat dinner. So that's one thing. He says, the governor says he is going to make the mask mandate stricter. So, but then at the same time, he says he's not the mask police. So I think he's just encouraging people to wear masks more. They're not really going to do anything. He didn't mention any tickets or fines or anything like that. So none of that stuff's going to really change as far as I can tell. He's just basically telling you, hey, if you're gathering with people that don't live with you, wear a mask when you're at home, even inside your own house, if you're with people that don't live with you. So that's what I got from his stricter mask rules. Let's see, I think they're going to drop capacity to 25% for gyms and those types of things. If you're going to the gym to work out, you have to wear a mask no matter what. Even if you're doing strenuous activity, you have to have the mask on at the gym. So 25% capacity at libraries, arcades, bowling, all that stuff, theme parks. What else we got? Now, one thing I'm not sure about, I'll have to verify later, it said also 25% gaming capacity. Let me know if you guys heard that also, which sounds like it means, like reducing the number of people in the casino by 25% more strictly. I don't know. I don't know about that. So I think I heard him say that, but I'm not sure. Public gatherings, 50 people or less, including churches, theaters, weddings, funerals. Doesn't include schools. Private gatherings, like you having something at your house, Thanksgiving or whatever, 10 people max. I used to sneak them in the back door. I don't know. From 2 households only. So I don't. A lot of this stuff is probably more about recommendations. They're not really going to have any way of enforcing a lot of this stuff. So it's just to try to get people to think about it, I guess. Let's see, big retail stores and all that, 50% capacity. They want them to have people outside with little clickers, little counters or whatever to see how many people are in the store at any given time so they can make sure that they're at 50% or less. But I also think I heard him say hair salons, nail salons, massage parlors, tattoos, and all those places, piercing studios are pretty much remaining under their current existing rules. So yeah, I don't know what those are. Maybe it's 50% still. I don't know if they're going to be 50% or 25%. So I was just writing it down on an envelope here, trying to take as many notes as I could. So the whole thing lasts for 3 weeks, called the 3-week pause, applies to the whole state. What else? And yeah, if it gets worse, he says it'll get more strict. I just don't see him closing casinos. It's just too big of a solid part of the economy in Las Vegas. You know, there's too many people that are employed there. They might do this thing kind of how LA did, where the restaurants, you know, if the numbers don't improve over the next 3 weeks, you know, the thing I see him possibly doing is getting more strict on restaurants and bars and all that stuff again. So hopefully things will remain flat or better. I don't see how it's going to get better because everything on the news says it's getting worse, right? So I don't see it getting better on its own. It's just that's just the way it is. Especially the regular flu is coming too. So, but the regular flu hasn't been too bad. I don't know. Maybe it's because everybody's wearing masks outside most of the time. Maybe that's helping. So let's see. That's basically where we are. Yeah, would I take the vaccine? Probably not on day one, but I mean, I heard some stuff about most of the stuff that I heard is like they giving it to a few thousand people right in the test groups, and like they haven't had anybody die from it, so I guess that's a good thing. And percentage wise, they say it's like 90-95% supposedly to block you from catching it. So I just want to get back to normal. You know, I want to get out there. I want to get back to normal. I don't want to be thinking about it too much. I think after a lot of people get the vaccine, they're still going to have mask rules for like probably a trailing 6 months or a year, because unless they give you a special stamp on your driver's license, you're still not going to know who really got it, who didn't get it. And if a bunch of people are around you without masks, if you're worried about it, you're like, and they all say, "Oh, I got the vaccine." Well, you can't prove that. So I think they'll still keep sort of like mask rules going for like a few months after the vaccine's been rolled out for a while. But everybody can sort of chill out more. You know what I mean? We can relax. Maybe we won't have the super restrictive rules anymore, because they'll be able to tell number-wise how many people they've given the vaccine to in a city anyway. Say LA, okay, we've given 10 million people the vaccine in the LA area. So that reduces the risk by like half or something like that. That's my thoughts on it. So I am going to check out the rest of the questions that they're asking here. And yeah, I just wanted to share that live with you guys real quick. I might do another video again this week. I have an idea for another video, so stay tuned. I don't know if it's going to be live or if I'm going to upload it. Don't forget to click subscribe for anybody that's watching the video that's not a subscriber yet. And I appreciate you guys tuning in and checking it out. So I'll see you again soon. Thanks.